So, we all know that Florence Nightingale started the process of nursing becoming a profession. So, why is it so important if nursing is considered a profession or not? Well, nursing is a healthcare profession that involves years of training and continued specialized education to care for patients in a variety of settings. And oftentimes, nurses are the first healthcare professional patients actually meet. They're a technical expert. They're an educator in many different instances, not just with students, but you're educating your patients, you're educating your patients' families, and sometimes even educating other healthcare professionals. You're a counselor to many people, and you're a resource for the patient and their families as well. So, we've really worked hard over these years from the time back when, nursing was started, from Florence Nightingale's time. So you've worked hard, or we have worked hard to be able to call ourselves a profession. So let's talk a little bit about what a profession actually encompasses. So what's the difference between a profession and just say a job, right? A job might be everybody has to work and make money, right? So you might just get a job just for some income, but it's not your lifelong calling or something you plan to do or spend a lot of time preparing for. Of course, they might give you a little orientation or something when you start the job, maybe like at the restaurant or retail or something like that. But a profession, it's a type of occupation that requires prolonged preparation and formal qualifications. So with the profession, you spend some time training and learning the skill, and it's something you plan to make a career out of and spend your life's work doing. So your book discusses three leaders, Flexner, Bixler, and Pavalko, and they have identified some characteristics of what a profession entails. So first they say a profession, one characteristic of a profession would be having a high intellectual level. So as a nurse, we need to be able to have excellent assessment skills. You need to be able to identify if something's going wrong with your patient, and you need to intervene right away before it becomes detrimental to your patient. High level of individual responsibility and accountability. So what does that mean? That means you can't blame the doctor for your mistakes. So yeah, if there is a mistake, the doctor may have some accountability in it, but if you actually made the mistake, you're going to be held accountable for your mistakes. Specialized body of knowledge. Specialized body of knowledge. So as nurses, we do have a specialized body of knowledge. Nursing science. Nursing science is a specialized body of knowledge. We have nursing theories, which is discussed, will be discussed in chapter 3, I believe it is. Evidence-based practices. Evidence-based practices is information that is derived from research. So everything that we as nurses do should be based from evidence-based practices. We shouldn't just do something or do an intervention because it's just always what we've done. There should be some research or some science, nursing science behind it to say this is the best method or this is the best strategy or intervention we need to perform for our patients. We used to do a lot of things in the past, but we don't continue to do them just because we've always done it. You know, back in the day, nurses didn't used to wear gloves. But now nursing science and research, evidence-based practices tells us that anytime we're coming in contact with blood and body fluids, we need to wear gloves. So we need to base our decisions and things on evidence-based practices. And that's going to come from research to tell us what are the best methods. All right, some other characteristics of a profession that were defined by the three scientists that we previously discussed. Knowledge that can be learned in institutions of higher education. So that's what you're doing now. You're gaining knowledge by going to college to become a nurse. Public service and altruistic activities. That means you're unselfish. You do things unselfishly. Public service. The public consists of a variety of people. That could be your patients, their families, the public as a whole, the whole community. So doing things for the public in an unselfish manner. Also, public service valued over financial gain. So obviously nurses aren't millionaires, right? So you're doing these public services not to become wealthy millionaires, but obviously because you're caring and being unselfish, as we discussed. Relatively high degree of autonomy and independence of practice. So nurses are gaining more autonomy as time goes on. There are some independent activities and some interdependent activities that nurses perform. Interdependent means you can't do these things unless say you have a physician's order or something. So interdependent would be things like passing your medications or performing treatments or things like that. Interdependent. So, you know, we are nurses and do have some autonomy, but at the same time, we still have to work closely with our healthcare providers, you know, such as the physicians, the pharmacists, and things like that. Independent activities would be things nurses can do independently. So you're drafting your nursing care plan, right? So, and basing them on nursing diagnosis and things that you as the nurse can do to help the patient achieve those goals. But also we have advanced practice nurses, and many of our advanced practice nurses, we'll discuss them probably in more detail later, but many of our advanced practice nurses, they have the authority to write prescriptions and things like that. In Ohio, our advanced practice nurses, they have the authority to write prescriptions and things like that, but they still have to work under a physician in their whatever area, whether it be family nurse practice or nurse midwife or whatever area that they're working in. But we'll talk about in later chapters, there was a law trying to get all states under the same practice of with the things that their advanced practice nurses can do, because different states were allowing their nurse practitioners to do different things. Some states didn't require their nurses to practice under a physician, and others did. And so some of the states came under that law, but others still have not. So to be considered a true profession, according to your book, nursing must be recognized by other disciplines as having practitioners who can practice nursing independently. And so we're getting there, with our advanced practice nurses and becoming more independent and having more autonomy as nurses. Need for well-organized and strong organizations representing members of the profession and controlling the quality of practice. So yes, the nursing profession does have some well-organized, strong organizations. For example, we have the National League of Nurses, which the primary responsibility is for regulating the quality of educational programs to prepare nurses rather. We also have the American Nurses Association. And the American Nurses Association is more concerned with the quality of nursing practice in the daily healthcare setting. So we do have that when we're talking about nursing being described as a profession. Another quality described by the scientists was a code of ethics that guides the members of the profession in their practice. And we do have a nursing code of ethics. Our nursing code of ethics was established by the American Nurses Association. And it's the American Nurses Association Code of Ethics for Nurses, which is the most widely used code of ethics in the United States. The most updated one is the 2015 American Nurses Association Code of Ethics. So two more characteristics of a profession that were described by the scientists were a strong professional identity and commitment to the development of the profession. So as we stated before, there's a difference between a profession and just a job. A job you're not going to have a commitment to. So a job being McDonald's or something of that nature, you're not going to necessarily have a commitment to. You haven't put a lot of time and energy into training and preparing for that particular position. Whereas a nurse, you're putting a lot of effort and training into becoming a nurse. So you're going to have a commitment to that career or profession. You're going to have more of a commitment to your nursing career. And also demonstration of a professional competency and possession of a legally recognized license. So yes, we do have to obtain, pass the NCLEX and obtain our license. By passing the NCLEX and obtaining the license, you're showing that you're competent enough to be able to perform safely as a nurse. So let's think about this. By these standards that we've just described, is nursing a profession? I would think so. Nursing is a profession based on these standards that we have just discussed. So think about some of your own experiences that you've had, and are there any other aspects that you might think of as being a professional? All right, so these are just the skills again that we've discussed already. High intellectual level. So some of these tasks, although like we talk about our assessment skills, right? And it's not just knowing how to do something. A lot of people know how to take somebody's temperature, but being able to properly interpret what that temperature means for your particular patient, or a blood pressure. They have a lot of different electronical equipment that a person can take a person's blood pressure at home. They don't need skill to take it, put it on the wrist or put it on the arm, and it can pump it up and read the blood pressure themselves. But high intellectual level, do you know how to interpret what that means for your patient? What are the next steps that you need to do for your patient? Everyone doesn't have that same intellectual ability to be able to do that. High level of individual responsibility and accountability. So like we said before, you can't just go and blame the physician for your mistakes. If you have a patient and the physician has ordered a medication, and you have the intellectual knowledge to know something's not right about this order, I'm not sure this is the right treatment for this patient. This patient could have a negative effect based on XYZ. It's your responsibility as the nurse to call that physician and question the order. If the physician gives you an answer that's acceptable, okay, then you administer the medication. If the physician cannot give you an explanation that you're satisfied with, then you have a right to refuse to give that medication. But you have to be able to document your reasoning for refusing to give that particular medication. If you just simply give that medication and don't question the physician, and then there's a negative effect on your patient because you didn't question, then you can be held liable. You can't just simply say, I gave the medication because the physician ordered it. So you have to, you can still be held liable, even though it was an order written by the physician. You can still be held liable. This is a very litigious society now, and so nurses are the targets of a lot of malpractice lawsuits in this day and age. So you work very hard for your license, so you need to do what you have to do to protect your license as well. So as I stated before, we have a specialized body of knowledge. We have nursing science, we have nursing theories, and we have evidence-based practices. So there's nurses out there conducting research on a regular basis, doing quality improvement research and initiatives to find out what's the best evidence-based practice for us to base our decisions on. So all decisions and interventions that we implement for our patients, there should be some evidence-based knowledge behind that. What research was done to show that this is the best strategy or the best intervention for me to implement for my patient. So there's a large body of nursing science out there. Lots of theories. We'll talk about theories in chapter 3 as well. Okay, evidence-based practice. So your book defines evidence-based practice as the practice of nursing in which interventions are based on data from research that demonstrates that they are appropriate and successful. It involves a systematic process of uncovering, evaluating, and using information from research as the basis for making decisions about and providing client care. So basically it's just like I stated before, it's based on research. It's how we provide care to our clients. It's how we determine what interventions and strategies we will use for our patients. When we establish our nursing care plans, when we come up with our nursing care plans, and then you come to the interventions part, when you're planning your interventions, those interventions should be based on evidence-based practices. What does the research tell us are the best interventions for whatever the problem is that we have identified. If our patient is high risk for skin breakdown, then the evidence tells us we need to make sure we reposition our patient every 2 hours, that we're padding them, you pad and protect if necessary, if we can encourage them to ambulate, and things like that, keeping the area clean and dry, keeping the sheets free of wrinkles. The evidence tells us that if our patient is high risk for infection, the evidence tells us the key indicator to prevent infection is hand washing. So, what does the evidence tell? What is evidence-based? We're not just pulling things out of the air when we're trying to come up with our nursing interventions. We're not just pulling things out of the air, or just pulling things. Somebody told us that this might be good if we try this. No, what does the evidence tell us? Evidence-based practices. That's what all of our interventions and strategies and care that we're providing for our patients should be based on. Okay, so another one of our characteristics of a profession was public service and altruistic activities. So what did we say this was? It said this was providing service to the public that was unselfish, right? So we should be trying to help our patients achieve their maximum level of functioning, helping them adapt to illnesses and achieve their maximum level of functioning. But we should be doing this in an unselfish manner. We shouldn't be trying to gain something by doing, whatever activities that we're trying to do to help our patients. Well, I'll help you if you give me such and such. No, that's not what we're doing this for. Well organized and strong representation. So like I said, that's our nursing organizations, like our National League of Nurses and American Nurses Association. We, as nurses, should join a professional organization. When you have more nurses in the organization, you have more voices, then the organization can be stronger as an organization, and advocating for the nursing profession, and advocating for patient care and patient practices. But the problem is not enough nurses actually join the profession to make it as powerful as it could be. So, when you have, like I said, you have more of those nurses joining the organization, you have more voices that can, create that power to be powerful, to advocate for patients in the profession. So these other two, Nurses Code of Ethics and Competency and Professional Licensure. So like I said, we'll talk more in detail about the Nurses Code of Ethics in a later chapter, but we have the Nurses Code of Ethics that was established by the American Nurses Association. The most current version of this, there's been several versions. The most current version of the Code of Ethics for nurses is from 2015. And competency and professional licensure. So of course, in order to become a nurse, you have to pass the NCLEX once you graduate from an accredited school of nursing. Every state has their own licensure exam that you must pass. And so because different states have different laws and things like that that you need to understand. So if you take and pass the license in Ohio, then you want to go to another state to practice nursing. You'll have to contact that state's board of nursing to find out what their rules are for you to become licensed in that particular state. Some states you can get endorsements without having to take their particular licensure exam. And then some states, I've heard that maybe you might have to take a smaller version of the exam or whatnot, and some you might have to take the whole exam. So you have to contact that particular board of nursing to find out what it would be required of you if you're licensed in another state to become licensed in their state. So autonomy and independence of practice. So nurses do have some autonomy and independence. Again, starting way back from Florence Nightingale, she began to separate education of nurses from that of doctors to kind of make that separation and show that nursing had its own body of knowledge that was separate from that of physicians. But like I said before in a previous slide, nurses do have some independent functions, but they have a lot of interdependent functions where they must have the physician's orders in order to perform certain duties. You're not going to give a medication or do a treatment or anything unless you have the physician's orders. So those would be considered interdependent roles. But there is a lot of autonomy for nurses. You have your nurse practitioners, you have certified nurse midwives who can they can write prescriptions, they can make diagnoses. We as just regular nurses, of course, can't make a medical diagnosis, but a nurse practitioner could make a medical diagnosis. But although these nurses have this level of independence and autonomy, there still has to be a physician that is over that individual. So nursing has made great strides moving towards a profession. And so as a profession, that's something you would have would be your career, your lifelong career. And so when we talked about profession or career versus a job, a career is something you have a commitment to. That's your life's work. That's what you've put your training and your dedication to, and in your career, and you're committed to it. A job, there's no commitment, no long-term outcomes. You haven't put in the training, extensive training for that job. I mean, like I said, you might get a little orientation to learn the job, but there's no extensive training that you've put into that job. You don't have any commitment to that job or whatnot. But some still look at nursing as just a job. There's no commitment to it. You have people nowadays, you can get a nursing job so quickly, and you have people going from this job to that job to this job to that job, and bouncing around and not really making a commitment, not being committed to it. So you got to think about it. Really, is nursing a profession? Is it your life's work? Are you committed to it? Why do some people think of it as a job? Why do you think that is? Think about that. Why do you think some people may think of it as a job versus a career, and not be committed to what they've trained for? All right, so the healthcare team encompasses a great deal of people, a great number of people. The healthcare team, that could be your physician, your physical therapist, your occupational therapist, the speech therapist, the pharmacist, the dietitian, the radiologist, the social worker, the respiratory therapist, psychologist. You have so many people that's a part of that healthcare team that we as nurses need to collaborate with to achieve the best outcomes for our patient. And even as nurses, there's so many different roles we as nurses can play. So you have the RN that's on the floor, you have the unit manager, you have the nurse practitioner. Some nurses are case managers, right? You even have your LPNs. So there's a lot of different roles we as nurses can play as well. And so even that RN on the floor may be collaborating with not only other members outside of the nursing team, but also other nurses that are playing different roles within that team. So all these people play a part, are a part of the healthcare team, and play a part in helping to achieve the patient's fullest potential or optimal level of functioning. Okay, so you have different types of advanced practice nurses. Your advanced practice nurses are going to have a minimum of a master's degree. So they have to at least have a master's degree. There's been some push for them to have their DNP, Doctorate in Nursing Practice, but that's not law at this time. So minimum, they have to have at least your master's degree. So you have nurse practitioners, and then you have also clinical nurse specialists. So our nurse practitioners, so I'm going to give you what your book says here. Your nurse practitioners are prepared to provide direct care in primary care settings, focusing on health promotion, illness prevention, early diagnosis, and treatment of common health problems. So these individuals are in the primary care setting, unlike your clinical nurse specialist, which we'll discuss that in a minute. So dependent on in a few slides back, I said different states are different in what they will allow their nurse practitioners to do. There was some laws trying to be put into place so that all states were the same in what they allowed their nurse practitioners to do, but as of right now, all states haven't gotten under that law, so it's still some differences among some different states as to what nurse practitioners can do as it relates to making diagnoses or prescribing medications and things like that. So there's still some differences between those individuals. You also have a certified nurse midwife who is, particularly similar to that nurse practitioner, but the difference with the nurse midwife is the difference in the nurse midwife and the just a general nurse practitioner. The nurse midwife focuses on the care of pregnant women before, during, and after the birth process. And then they also have some, extensive education when it comes to newborn infants as well. All right, so then you also have your clinical nurse specialist. And so the difference with the clinical nurse specialist, like I said, the nurse practitioner. The nurse practitioner is in the primary care setting, whereas your clinical nurse specialist is in the secondary or tertiary care setting. And they focus on individuals who are experiencing an acute illness or an exacerbation of a chronic condition. So that's your differences there. There has been some talk about kind of combining the two, into one, but those are your big differences between the clinical nurse specialist and the nurse practitioner. Clinical nurse specialist still needs minimum education of a master's degree as well. All right, so then you also have nurses that are case managers. And so your case managers coordinate services for clients with high risk and long-term health care needs or problems. So you got case managers in all types of settings. You got case managers in your acute care facilities, your rehab facilities. They might work for managed care organizations. Their whole goal is to coordinate patients' healthcare services in the most efficient and cost-effective manner. So that's why you get your case managers involved. They're trying to, make sure everything's coordinated. So if you're in the hospital, you got a patient being discharged to a rehab, you got your case manager there coordinate that whole process and making sure it's the most effective and efficient and cost effective plan for that patient. All right, so at this time, case managers can, different people can serve as different people can serve as case managers. You can have physicians as case managers, social workers as case managers, RNs as case manager, LPNs as case manager, or you can even have just your regular lay person that has little healthcare education as a case manager. So there has been a development of some certification for certifications for nurse case managers, because you think about it, if you got somebody that's coordinating healthcare services for a person, is it really feasible to have somebody with no education in the field trying to coordinate services? Do they really know what this person may need or potentially need, and what types of services they should be thinking about for this person? So now there's some certification that individuals, nurses can obtain to become case managers, because really you would want somebody with some type of experience in this role, so that they can remember I said the goal is for them to coordinate the health services in the most efficient and most cost-effective manner. So to do that, you need somebody that has some level of education in the field to be able to do that appropriately. Okay, so let's talk about empowerment in nursing. So power. What is power? Power is, or the nature of power is having the ability to exert influence over another person or group. So being able to influence a person or group in some fashion. When we talk about authority / responsibility imbalance, that's when you have nurses that have a lot of responsibility but little control over their practice, and so they're not necessarily empowered. Although power and being empowered sometimes tend to have the same meaning, there is a little difference between the two. Let me tell you what your book says. It says empowerment helps the nurse to take action and perform those activities that promote patient care, while power is associated with control and authority. So when we think of it in this sense, empowerment, so I as the leader may empower you to be able to make decisions on your unit. I empower you so you don't have to come to me and ask me, can you do, certain things on your unit. I empower you to do that. Whereas power, I have, as the nursing director of the hospital, I have the authority to make decisions on what the whole nursing staff will do. Versus empowerment, you can empower your nurses to, be able to do things. Nurses that are empowered, some characteristics of them would be like strong. They're strong, they have a positive attitude, they're highly motivated, and they're able to motivate others. And nurses without power are typically provide poor care. They don't respond well in a crisis. They might be lazy. They're probably unhappy. They burn out easily. So those are nurses that we definitely don't want to become. Those that are powerless or feel powerless. So we want to be empowered. So let's talk about, we're going to talk about some different types of power that we might have. So referent power depends on a close personal relationship. So that means you can get someone to do something because of a close relationship you have with that person. So maybe you might be able to get your husband to do something just because you have a close personal relationship with that person. But I can't get your husband to do that because I don't have that close personal relationship with that person. So we as nurses, when we build up these relationships with our patients and develop, close relationships with our patients, they start to, trust us and things like that. And so when we have that close relationship, we can get them to do things just because of, that relationship we've built with them. Maybe they'll do something for this nurse that they have that close relationship with that they wouldn't necessarily do for another nurse, if that makes sense. Expert power derives from the amount of knowledge, skill, and expertise that an individual or group has. So nurses use this type of power when they teach like their patients and their families. They counsel them, they motivate them, things like that. So expert power. So I'm going to do what my nurse says because she has this knowledge. She's teaching me, and I'm going to do it because she's the expert at whatever it is you're teaching me how to do my diabetic injections, insulin injections, or something like that. Power of rewards. That depends on the ability of one person to grant another some type of reward for specific behaviors or changes in behaviors. So when a person can give a reward for a specific behavior. So Ms. Jones, if you eat your dinner, then I'll give you a piece of cake once you get done. So some type of reward. So I'm going to do this so that I can get the reward that you have for me in the end. All right, coercive power. Coercive power comes from the ability to reprimand, withhold rewards, and threaten punishment. So this one is the opposite of reward power, right? So coercive power, I'm going to punish you, I'm going to withhold you. This, you might use this with your children. They don't do with what is expected from them. You take their electronics away, or you take their phone away, or you take some privileges away, right? That's coercive power. As nurses, you could do this, but it's probably not recommended. Withholding something from your patient, it's not going to build up a therapeutic relationship with your patient. So it's probably not going to be the best method. Legitimate power depends on a legislative or legal act that gives the individual or organization a right to make decisions that he or she might not otherwise have the authority to make. So with legitimate power, this is like a legal power that uh, entity or person might have. When we talk about legal power, legitimate power, the State Board of Nursing has legitimate power, right? So they can, um, if they need to reprimand a nurse or something like that, they have legitimate power to do that. They have legitimate power to restrict your license, or legitimate power to take away your license, or anything like that. Legitimate power to give you your license as well, right? And so if they do give you your license, we as nurses then have legitimate power to make nursing decisions. The State Board of Nursing can give us legitimate power to be able to make nursing decisions and practice nursing legally. All right, collective power. Collective power when you have a large group with similar beliefs that comes together in an organized fashion. So, like when we talked about nursing organizations like the American Nurses Association or something like that, nursing organizations can collectively, come together to influence policy. So that's why I was saying, when you have more nurses or more voices in that organization that can voice their opinion collectively, if I go and try to influence a policy by myself, then I might not be as influential as if I was with a nursing organization and we all together collectively try to influence a nursing policy or a healthcare policy or something like that. So collectively together we have more influence and power than each individual by themselves. Similarly, the media can be considered collective power as well. Like when you have the media, if you have all these large media outlets working together to influence the voters to go one way or the other, influence the voters to vote yes on this issue or no on this issue, or vote for this political figure or that political figure too. The media can be a pretty powerful collective influence and power as well. Okay, so how can we as nurses become empowered? Um, well, first of all, by educating ourselves. So become educated. You can't make influence others if you're not educated yourself. So you guys are taking the first step by educating yourselves to become nurses. So the more education you have in healthcare, the more you can voice your opinion on things because you're knowledgeable in certain areas, right? So when you're in your workplace, you can get involved in committees and things like that and help influence decisions within your workplace. A lot of times organizations will ask for different committee members to help with different things, help start influencing decisions within your workplace. Get involved locally, get involved in your church groups, influence decisions that way. Get involved in your local PTA, influence decisions within your child's school. Political organizations, getting involved in various political organizations to help influence decisions. Gaining more experience. Education is one way, but experience is another way, right? The more experience you have in an area, the more influential and empowered you can become. As you get more experience, maybe you want to run for office or something. You definitely can become empowered and influential in that way. And then once again, like I said, joining some type of professional organization or something will help you become empowered and more influential as well. Professional unity. So you're going to hear a lot in this course. We talk about joining professional organizations. The more members in a professional organization like the American Nurses Association has, the more influence and the more power that organization can have. So we need nurses to join these professional organizations so that we can have more influence when it comes to healthcare policies or nursing policies, or different things that's going to affect the nursing profession or affect patients. You think about it, we're talking about affecting patients. Who's to say we won't be a patient at some point, or one of our loved ones be a patient at some point? And so it's not only the patients that we serve, but it's, it could be any of us that, are patients at any, given point. Policy, if we're helping to influence healthcare policies and things like that. So joining a professional nursing organization, you'll hear a lot about that this course. All right, political activity. We'll talk more in detail later in another chapter about becoming politically involved as a nurse. But being politically involved is a great way to influence the nursing profession and become empowered, because who makes the laws? The politicians, right? So if we want to influence healthcare policy, we need to become politically involved. So that can look like a lot of different things. Being politically involved doesn't just mean running for office. You could write letters to your elected officials to be politically involved, or lobbyists, or different things. Like I said, we'll talk more in detail about that, but definitely being politically involved is a way to become empowered. Accountability and professionalism. You don't want to be a lazy nurse. You want to take responsibility for your actions and for the care that you're providing. You want to hold yourself accountable. You want to be professional at all times, and that starts now in the classroom. Being professional, holding yourself accountable, taking on responsibility. If you can't take responsibility now to do your classwork, to take care of your patients in your clinicals appropriately, if you're just walking around clinical complaining about, well, I don't want to do that, or I don't feel like doing that, what are you going to do as a nurse? So that starts now. Be professional, be accountable for things, for your patient care and for your patients and for your schoolwork and for your learning and for your education. Another way to become empowered in nursing is through networking. Get out and meet people of power, people of influence. You can intentionally put yourself in networking positions. There are specific networking opportunities that you can actually attend. That's what it's called, a networking opportunity. Or just make sure you know the director of nursing of your organization, or higher up individuals. Get to know them, develop relationships with them. Your book talks about this old boy network, or old boy system. It is still alive and well, and it's true. Not always what you know, but who you know sometimes. And so that old boy network, that still is true as of today. So get to know people of power, and develop some relationships with them as well. That will help you in your career as you're moving forward. When we talk about things that have affected nursing, the Affordable Care Act was something that tremendously affected nursing, and how we practice in some areas. And so nurses, we'll talk in great detail more about the Affordable Care Act in some later chapters, but nurses were at the table when the Affordable Care Act was developed. And now with this current administration, there's been a lot of talk about revisions and things like that, and nurses should definitely be at the table again when and if additional changes are made to the Affordable Care Act, because these things definitely affect how nurses will practice and how it's going to affect our patients and things like that. So we definitely need to make sure we're at the table for that as well. So professionalism is, definition for that is demonstration of high level personal, ethical, and skill characteristics of a member of a profession. So as nurses, we definitely should be practicing professionalism, having a high level of integrity, ethical characteristics and qualities, honesty. You want to be able to provide the best care in an ethical, professional manner for your patients.